Hi guys, it's Erin. So we have actually just passed the 12-week mark. Finally! Yay! 3 months. That was a very, very long 3 months. Some people are like, wow, that went so quick. But I thought, I've never had 3 months drag so much in my entire life. Not that a recovery type sort of outlay or design changes, but I guess it's just that bit of a milestone. So, 12 weeks, what does that mean? It means that I've had my final post-op appointment. I had that last Thursday. It's Sunday this evening. My surgeon is super happy with my recovery and my scar. There's been a little bit of pulling in the scar, but it's lengthened than the width of my fingernail. It's very, very minimal. And I did thoroughly expect that when I started physio, because obviously I'm moving my arm, the skin's going to pull. So he's good with my movement. When you do the forward movement and the back and the side out movement, it's not as good as what I would like, but I have nothing to compare it to personal recovery wise, so I guess that's just me putting pressure on myself. I did say to my surgeon that I had a lot of difficulty going behind my back, and he said, well, I didn't ask you to do that one, did I? And he said a lot of people have that issue, and that's a very hard one to overcome. He asked if I had any questions, and about all I could think of was I can actually feel a couple of bumps underneath my scar. And he sort of said to me that there are actually quite a lot of stitches underneath there, and he suspects that the top bump, what I can feel, is actually one of the bolts. But he said as I develop muscle again, the feeling of that I will lose that. So that's positive, and he was really, really happy, and I am so thankful to him. He has been absolutely amazing since I first saw him. Where are we? It's August. Last May we decided to have the surgery, and I think I probably started seeing him February last year, and I'm so thrilled. He was professional, but he was human, so we could have a joke. He was very matter of fact, but also made sure that I understood what was going on. He made sure that I was calm with what was going to be happening, including the recovery process. Dealing with him has just been, I could not have asked for a better surgeon. Seriously. I will gloat about Mr. Killer Up for as long as I can, because he was just sensational. So what else does 12 weeks mean? Generally 12 weeks also means that the surgery is now almost 100% secure. So for most of the populace, that means that your recovery from the operation is almost sort of complete. I still probably have another week or two, just given that I'm a type 1 diabetic, and we take a little bit longer to recover from these kinds of things. But, it's pretty standard, so I'm not overly fussed. I'm not doing anything too silly with it at the moment. I'm actually really dying to go ice skating, and I'm dying to go back to bounce. But I have to just hold back on them for a little bit. What else? I am back completely teaching and completely dancing. I still have a few issues with movement, but again, it's no different to other videos that I've made. It's just one of those things. And the other one is getting off the ground, so using my right arm to push up on my body weight. And I even find that getting out of bed, I get a little bit of pain trying to, push up on from my torso. So, what else? Physio's going really good. I have been a little bit slack because I guess I got sort of a bit disheartened because I didn't think I was making the progress I thought I should be making, which is silly because I've got nothing to compare it to. But I just felt like I wasn't seeing the results that I thought I should be seeing. But it's difficult. It's one of those things I have to keep myself motivated. You know, a couple of videos back, I think I was saying, you know, my hair goes up now into the top part of my head, which it does. It takes a bit of time to get up there because I kind of have to flip all my hair over and brush it upside down to twirl it all up so I end up with this bun on top of my head. To help practice with the behind my back movement, I now do try and make sure I actually do my brow up behind my back. I am doing it up kind of at the base of my spine, but I am forcing my arm to go behind my back to get that movement happening. So my physio is happy with how it's going. He really hurts me when he's doing his massage and stretching. You know, he said to me last week he had obviously my right arm, but he had it all the way back here, and I think he actually had passed my ear up, you know, so up past 100, so, you know, behind my ear while I was laying down, so I was obviously out to the side of it. And he said to me, "Well, look how far back your arm is." I said, "I can't, I'm in too much pain. I need to keep breathing here, and I need to keep concentrating." And he had a giggle at that, but he's also really nice as well, very, very personable, loves to chat, tells me what he's doing, things I can do massage-wise to help with all of this and the relaxation. Because, you know, 6 weeks without using anything, and then I guess 6 weeks then only really doing minimal exercise because I wanted some physio behind me before I went back to the gym, and I was very anxious with what I did with it, with dancing and stuff. So, you know, those muscles are now trying to reactivate and it hurts, and so he's massaging them out, and that hurts a lot. Last week I had to big breaths. There were potential for tears last week. It hurt a lot. One thing he did say to me is I thought I was doing really well because of all my classical training, you know, the up movement. I thought I'd been doing really well. I mean, you can still see how much lower my right shoulder is there, really. You know, I thought I was doing really good with my up movement to keep my shoulder quite down, and so making sure I'm engaging all of these muscles, not these muscles. So I was, you know, but as you can see, not so much. So I'm actually, he's told me I have to physically hold my shoulder down to move my arm to make sure I'm engaging these front muscles and these back muscles here, not my neck muscles and my muscles for my shoulder blade and pecs and delts. So that's just, I guess, a continual process, one I have to be patient with, one that I have to tolerate, and one that I just have to work at. And it's very difficult, and I'm very conscious about how, you know, having had the surgery, I'm still I'm still not confident to like to lay on it to sleep. But in the last 2 days, I have actually removed that prop pillow from underneath my arm. I do have some endone. My GP gave me another script. I'm specifically using it for my nighttime sleeping only after I've been to the physio and if I've been to the gym, because I've gone back. I went back last Wednesday. I've only been back the one time, but that's just because of my schedule and how busy it's been. So that was really good. It was embarrassing because, you know, I'm doing my bicep curls, and where I might have been using 5 kilos beforehand, I'm back down at 1. And those things are tiny. They're tiny. They're like this big. And they're like this thin. They're tiny. They're so small. But, you know, when I was doing my exercises with the weights, I realized that there's a reason why we start with 1 kilo. You know, it was actually, I could feel those muscles all working. So I'm glad it wasn't anything too heavy, really. I was using all the machines as per normal, but obviously I had taken everything back to the lightest weight. I found 3 that were not possible at all. I could not do lat pull down. So that's the one where you start up and you pull down. Obviously, given that I'm still struggling with the up position, that's why. Shoulder press. So here and up, again, it's that up position. And chest press, surprisingly enough, even on base weight, just because I find that enough works my muscles here. So, you know, I'm really, now that we've hit the 12-week mark and I don't need to see my surgeon again and physio is going fairly well, I am trying to now really get back into my pre-surgery routine with going to the gym and exercising. You know, there's a lot of other things going on in my life that I need to focus on alongside of my recovery here. I spoke to my anaesthetist last week, I think it was. Something went wrong with the bill. But, you know, we were chatting about it. And I said to her, I'm still very conscious of the fact that I had the surgery. And she said, yeah, well, it does take people about 6 months before they stop sort of having it be the first thing they think about before they do something. You know, if I try and pick something up, I still think, okay, can I physically hold this? Can I lift it up? Can I carry it? Sometimes it's no, sometimes I do have to put my left hand for support, but it's always my first train of thought. So I'm very prepared for that to be the case. But obviously, going to the gym, doing these exercises alongside my physio, making sure that what I'm doing with weights corresponds to what my physio is saying, you know, the stronger I get. Not necessarily the quicker I recover, but just the stronger I get, the more I do. I'm allowed to start with a basic plank exercise as well, only on the wall. I asked my physio about that sort of stuff the other day, given that I was so strong. And he said, that, yeah, look, just start off on the wall and progress from there, and that includes push-ups. So, and of course the different types. So elbow out is probably going to be a long way off, but I think elbow is in quite alright. So look, I guess I would say that my recovery is probably on track with where all the specialists think I should be, and that's the main thing. Nothing has gone obscure. The bolts are still in place. I kind of would have thought that there would be another scan just to make sure, but clearly not. I guess only if something goes wrong or if I do something silly will they do that. So I guess I'm just now going to really focus on my recovery and what I'm doing and making sure I get back up to scratch. It will probably be now a few weeks. I might try and do these things now once a month. Give you guys, you know, if anyone's watching, some regular updates. But yeah, just once a month, because I think if I'm thinking about doing these videos and showing my progress and I'm not making the progress, then I'll get disheartened and it just becomes a complete mind block. At the moment, I certainly don't need one of those. But, you know, recovering well, doing what needs to be done, but still getting back into and really, really enjoying life. Alrighty, so I guess that's me now at the 12-week mark. I hope you all have had a really, really good day, and I guess if you're in the process of this, just keep going. We're all in this together. Alright, I'll talk to you later, guys. Bye!